Asthma is a common chronic respiratory disease that affects millions of people worldwide. It is characterized by inflammation of the airways, leading to their narrowing and making breathing difficult. Asthma attacks can vary in frequency and intensity. Causes and risk factors. The exact causes of asthma are unknown, but it appears that there are complex interactions between genetic, environmental, and nutritional factors. 1. Genetic factors. There are familial forms of asthma with identified genes. 2. Environmental factors. Exposure to allergens, pollen, dust mites, animal dander, cockroaches, mold, tobacco smoke, pollution, certain chemicals or household products, and cold air can trigger asthma attacks. 2. Viral respiratory infections are also common triggers. 3. Other risk factors. Obesity, prematurity, low birth weight, a history of allergies, hormonal fluctuations, and bronchiolitis can increase the risk of developing asthma. Pathophysiology. Asthma is characterized by bronchial hyperreactivity, where the bronchi react excessively to certain stimuli. 1. During an asthma attack, the smooth muscles of the bronchi contract, bronchospasm, reducing the diameter of the airways. 2. Inflammation of the airways leads to swelling of the mucous membrane and increased mucus production. 3. These three factors, muscle spasm, inflammation, mucus secretion, result in a significant decrease in airflow through the bronchi, causing breathing difficulties. 4. Mast cells, immune system cells, play a key role in the inflammatory response by releasing substances such as histamine and leukotrienes. 5. Eosinophils, another type of white blood cell, also contribute to the narrowing of the airways. 6. In some cases, damage to the bronchial epithelium can allow allergens to penetrate, exacerbating inflammation. Symptoms. Asthma symptoms can vary from person to person and may include 1. Cough. 1. It may be the only symptom in some cases. 2. Wheezing. 2. It is often more audible during exhalation. 3. Shortness of breath, dyspnea. 4. Chest tightness. 5. In severe cases, patients may experience significant difficulty breathing, confusion, drowsiness, and bluish skin, cyanosis. 6. Symptoms may worsen at night or during exercise. Diagnosis. The diagnosis of asthma is based on 1. Clinical examination and patient history. 2. Pulmonary function tests, particularly spirometry, which measures the amount of air the patient can exhale in 1 second. 2. This test is performed before and after administration of a bronchodilator. 3. Bronchial provocation tests, which involve administering substances such as methacholine to assess bronchial reactivity. 4. Allergy tests can help identify triggers. 5. Additional examinations such as pulmonary auscultation, chest X-ray, and extrathoracic examinations may be useful in some cases. 6. Measurement of peak expiratory flow. Classification of asthma. The severity of asthma is classified as 1. Intermittent. Symptoms present 2 days per week or less. 2. Mild persistent. Symptoms present more than twice a week. 3. Moderate persistent. Symptoms present daily. 4. Severe persistent. Symptoms present throughout the day and severely limiting activities. Asthma control, which assesses the effectiveness of treatment, is classified as 1. Well controlled. Symptoms present twice a week or less. 2. Not well controlled. Symptoms present more than twice a week, but not daily. 3. Very poorly controlled. Symptoms present every day. Status asthmaticus is the most severe form of asthma, characterized by prolonged and treatment-resistant airway narrowing. Treatment. The goals of asthma treatment are 1. Prevent asthma attacks and control symptoms. 2. Reduce inflammation of the airways. 3. Dilate the bronchi to facilitate airflow. There are 2 main types of medications. 1. Anti-inflammatories. Inhaled, oral, or intravenous corticosteroids, leukotriene antagonists, and mast cell stabilizers. 2. Bronchodilators. Beta-adrenergic drugs, rapid or long-acting, anticholinergics, and methylxanthines. 3. Immunomodulators are used in severe cases of asthma. Treatments are tailored to each individual based on the severity of asthma and triggers. Therapeutic education is important for proper management of the disease. Treatment of an asthma attack. During an asthma attack, it is important to 1. Use a rapid-acting bronchodilator, usually an albuterol-type inhaler. 2. Move away from irritating factors. 3. Rest and adopt calm and deep breathing. 4. In case of a severe attack, consult a doctor or go to the emergency room. 4. Treatment with inhaled bronchodilators by nebulization, oral or intravenous corticosteroids, and oxygen therapy may be necessary. Prevention. The prevention of asthma attacks is based on 1. Identifying and avoiding triggers. 2. Good lifestyle habits, avoiding tobacco smoke, pollution, ventilating the house. 3. Regular maintenance treatment, according to medical prescription. 4. For asthma of allergic origin, desensitization may be offered. Prognosis. Asthma is a chronic disease that cannot be completely cured, but it can be controlled with appropriate treatment. In many children, asthma disappears in adulthood, but it can reappear later. Although severe asthma attacks can be fatal, most deaths can be avoided with proper management.